Hey, it's Nick Fogelson from Northwest Endometriosis and Pelvic Surgery. I just saw a patient back who we'd operated on for endo and adenomyosis who's doing great, and just thought I'd record a little bit about adenomyosis. So I wanted to talk a little bit about what adenomyosis is and what causes adenomyosis. These are some images I had from a blog post I made. Adenomyosis is a condition where the lining of the uterus, the endometrium, is actually growing within the walls of the uterus. And there's a couple different reasons why this might happen. One is that you could just be born with it. So there are some conditions of congenital adenomyosis where this lining of the uterus here is actually growing within the wall of the uterus. And because the lining bleeds, you can get these pockets of blood in the walls of the uterus. And you get pain, you get inflammation, you can get this kind of irregularity of the wall of the uterus like this. And then the menstrual cycle is really heavy and also really painful. I think that's sometimes the case, but I think a lot of adenomyosis is caused just by pregnancies. And the reason why is that when a baby is in the uterus, it forms a placenta. So you have this big patch of very, very vascular tissue. And believe it or not, the placenta does not just sit on the wall of the uterus. It literally invades the wall of the uterus. And a piece of the wall of the uterus is consumed by the placenta, and the placenta will sit in a pocket of the uterine wall, and literally the wall has been eaten up by the placenta. And then when the baby is born, the placenta undergoes some vascular changes that allows it to separate from the uterine wall, and then it comes off. And what you're left with is like a crater in the wall of the uterus here. And that crater is almost all the way down to the muscle. And so now you have this sort of bare patch in the uterus, and as this endometrium has to grow back in, it's kind of like you've got a bare patch in your lawn and the grass has to grow back in. And instead of growing back in this very, very organized, layered way, sometimes some of the endometrium can end up getting trapped in the walls of the uterus, and you end up creating pockets of endometrium within the walls of the uterus, and that's what we call adenomyosis. And so then you have these pockets like this. And if it gets bad, it can be quite painful, heavy bleeding. I just had a patient who I saw about 6 weeks out from hysterectomy. She was very happy, and she just had really heavy, painful bleeding. And on exam, her uterus was very, very tender. She was not able to have comfortable sex with her husband because penetration was really painful for her. And I saw her, she thought she had endometriosis when I first saw her. And I said, you know what, you might have some endo, but I think you have adenomyosis. And I think that she was at a point in her life where she wasn't planning on having more kids. And I said, you know what, a minimally invasive hysterectomy is just going to be great for you. And we took out her uterus. Now 6 weeks after surgery, I just did a pelvic exam, and she's very trepidatious because in the past pelvic exams had been very painful for her. And I told her, I said, you know what, I bet this is going to be the least painful pelvic exam you've ever had. And I did it, and it was, you know, she didn't feel hardly anything. She's like, oh my God, like nothing hurts anymore. And I said, yeah, because you had this really inflamed, painful mass at the top of your vagina every month, and now that's gone, and that inflammation has gone down, and now the vagina is healthy, and you can go and have comfortable sex, and you know, when you need an exam, it's not going to be painful anymore. So adenomyosis, it's common, and the more children people have had, the more they have it, and occasionally people that haven't had children have adenomyosis also. But when I'm dealing with pelvic pain, you know, this is a big part of what we're dealing with. It's not just endometriosis. You know, I deal with endo, but I deal with adenomyosis. We deal with, you know, sciatic nerve compression. Like I'm trying to look at everything that might cause pain, and this adenomyosis is a big part of it.